Hello everyone, and welcome to the next audio podcast in this series on the LabZtorm Effect v.2. This is the series around the LabZtorm critique. This is a scientist, and today I'm going to be talking about another important topic. This is another collaborative, another peer review publication that has come out from the Renal Patient Support Group, and this is a ZtormLabostix production in collaboration with the Renal Patient Support Group, or the RPSG. And today I'm going to be talking or giving an overview of this subject, nephrotoxic nephritis and glomerulonephritis, animal model versus human disease. And this is I'm just going to read out the abstract or the overview of this peer review publication. This was a paper that was published in the British Journal of Biomedical Science in 2014, and so here goes. Glomerulonephritis encompasses a range of immune-mediated disorders that generally cause inflammation within the functional components of the kidney, i.e. the glomeruli or glomerulus. Glomeruli relates to one when referring to one functional component or one nephron or glomeruli, whereas glomerulus relates to can relate to one or two as well, but generally when glomerulus are referred to, it can mean many. So generally speaking, this immune-mediated disorder causes inflammation within the glomeruli or glomerulus around of the kidneys, or the functioning components of the kidneys. Now, the pathogenesis of glomerulonephritis, or what's glomerulonephritis, generally the terminology means the inflammation of the glomerulus. Generally, the pathogenesis or the laboratory perspective on glomerulonephritis is quite complex. Intricacy arises from factors such as autoimmunity, cancer, and structural abnormalities within the kidneys or kidneys. Studies using animal models have highlighted crucial interaction between inflammatory cells and cell intrinsic to the kidney, both of which are fundamental to the pathogenesis of glomerulonephritis. This review, or this work, aims to provide an insight on a sort of a suitable model for excuse me, a suitable model for nephrotoxic nephritis and glomerulonephritis, or also known or abbreviated as NTN and GN, and relate its experimental validity to humans. And in this context, the animal models that are referred to in this peer review publications, like many other sort of studies and investigations that relate to chronic kidney disease, do focus on different mouse models. So in this context, one of the in this context, the BALB C NTN murine model, murine meaning mice or mouse model, and Winstar Kyoto rat have held experimental validity in the study of glomerulonephritis in humans. So in this context, these two sort of animal models, one being murine or mouse, and one being rat, both of them have a translational or translational premise when studying glomerulonephritis in humans, and sort of evidencing what's happening with relating to this particular disease in these two animal models when looking at the disease in humans as well. So in this context, these two animal models have held experimental validity in the study of glomerulonephritis in humans. The chemokine receptor, I won't go too much into. I'm not going to explain too much around chemokine receptors, but in general context, chemokine receptors are biomarkers that actually help understand where certain cells or immunological cells, for example, T cells or leukocytes, and also known as white cells. So T cells, there's cytotoxic T cells, and there's T helper cells, and other cell markers, how they migrate to different parts of where physiology is concerned, so that they either cause more risk of damage to the kidneys, or can actually be act as protective biomarkers in some cases, in some contexts. But in this work, the chemokine receptor CXCR3 also mediates renal T cell recruitment and subsequent tissue injury in nephrotoxic nephritis. It is noteworthy to consider CXCR3 blockade in T helper 1 mediated renal inflammation as future therapeutic options for patients with glomerulonephritis and subsets thereof. Currently used immunosuppressive therapies for glomerulonephritis are not always uniformly effective and are frequently associated with serious side effects. And in addition to this, corticosteroids are effective in several types of glomerulonephritis owing to their ability to prevent or inhibit the pro-inflammatory effects of cytokines known to promote glomerular inflammation. So there are differences, however, between experimental and human glomerulonephritis, and that can complicate the translational effects of experimental therapies into practice. More research is required to translate animal model research into a better comprehension of human glomerulonephritis disease. However, the complexity of GN, glomerulonephritis research, also makes findings a challenge to replicate. And in this context, just sort of an add-on context really is to say that because there is such a lot of work happening around glomerulonephritis, laboratory laboratory research in various parts of the world looking at this particular disease, it can get quite complicated quite quickly, because in some effects, so for example, if anyone, I'm sure anyone out there where they're listening, where listeners are listening to this, basically for every one outcome that's positive, potentially 10 or more complications can come out of that as well, because of the different pathways that are relating to immunology and physiology, in relating not just in in relating to pathologies around immunology and in physiology. And so therefore it makes it it can be complicated to find different sort of pathways to actually find cures or treatments to prevent glomerulonephritis actually occurring. Now, generally, the overall understanding that everyone should know in this context is, because the kidneys are kind of sensitive organs in relating to anatomy and where they're placed anatomically, and also because of their size generally are like fists, are kind of the size of fists normally, and also the sort of microvasculature that interrelates between the arterial, the efferent and afferent arterioles, and the the sort of vasculature that is around the kidneys. Generally speaking, that it makes it that much more. It makes, number one, there's a challenge in that context, but it also highlights generally that from an anatomical sort of disposition, if you like, that when it comes to glomerulonephritis, it highlights mainly in a sort of roundabout way, and at least in relating to human disease, is that everyone can do or take steps really to make sure they're doing more to taking care of their kidneys, to prevent glomerulonephritis happening or taking place in the first place. Now, I didn't talk too much about nephrotoxic nephritis, only to say that really nephrotoxic nephritis is basically sort of a marker of looking at glomerulonephritis in animal models to replicate glomerulonephritis in human disease, but also to say that in relating to nephrotoxic or nephrotoxicity, generally where in general health and population health, where people can be on a number of medicines that can prompt nephrotoxic can prompt nephrotoxicity occurring, potentially because of certain certain medications having or causing suspect incidences where patients can have some inability around renal function due to the nephrotoxic side effects that can come out from certain drug medication or drug categories. So therefore, in this context, glomerulonephritis is a well known and studied disease around nephrology and nephrology from a physiological perspective and a laboratory perspective. But in this context, what the RPSG, or the Renal Patient Support Group, have done is try to bring some of this context out into the open, with highlighting some of this work in this peer-reviewed publication. It's actually a biomedical essay that's been published once again in the British Journal of Biomedical Science back in 2014, and in this context, those who are interested into finding out more, do check out the basis of glomerulonephritis, and obviously, if you want to know more about what kidney function is, kidneys do, then feel free to check out more works around the Renal Patient Support Group. But keep your ears open and listen out for the next audio podcast around the next audio podcast in this series on the LabZtorm critique. That's it for now on this particular topic. I hope you've enjoyed it. It's been another collaborative effort between the ZtormLabostix production and the Renal Patient Support Group, and hope to catch you on the next